Hi, I'm Dr. Abhishek Mangeshikar, an endometriosis specialist and excision surgeon. Today, we're going to talk about a very important question that applies to all women. How often should you get a pap smear or a gynecological checkup? Routine gynecological care is one of the most effective ways to maintain reproductive health and detect potential problems early. Yet, many women are unsure about how frequently they should be getting screened or whether these guidelines change with age, risk factors, or medical history. In this video, I'll cover what a pap smear is and why it's important, current guidelines for how often to get screened, how often to see a gynecologist, even if you're not due for a pap smear, special considerations for women with conditions like endometriosis or other pelvic diseases. So let's get started. A pap smear or pap test is a simple screening procedure where a sample of cells is collected from the cervix, the opening to the uterus, and examined under a microscope to check for precancerous or cancerous changes. The main goal of a pap smear is to detect cervical cancer at an early stage when it is highly treatable, or to identify precancerous changes that can be managed before they progress. Thanks to pap smear screening, cervical cancer rates have dropped significantly worldwide, but only when women keep up with their regular screenings. Now, let's talk about the general guidelines that apply to most women. For women aged 21 to 29, a pap smear is recommended every 3 years starting at age 21, even if you are not sexually active, as HPV and cervical cell changes can still occur. For women aged 30 to 65, the preferred method is co-testing, pap smear combined with HPV testing every 5 years. Alternatively, if HPV testing is not available, you can continue with the pap smear alone every 3 years. For women over 65, if you've had 3 consecutive normal pap tests or 2 normal co-tests in the past 10 years and no history of cervical precancer, you may stop screening after discussion with your doctor. Now, this is very important to understand. Even if your pap smear is not due every year, you should still have an annual gynecological checkup. Your yearly gynecological visit is about much more than just a pap test. It gives us an opportunity to discuss menstrual health, pain, bleeding patterns, monitor pelvic pain or symptoms suggestive of endometriosis or adenomyosis, check for ovarian cysts or uterine fibroids, review contraception, fertility plans, and hormonal health, screen for sexually transmitted infections, perform a clinical breast exam, address perimenopause or menopause concerns if relevant. So even if your pap smear isn't due this year, please do not skip your annual checkup. As an endometriosis specialist, I want to highlight an important point here. Women with endometriosis or adenomyosis or chronic pelvic pain should maintain regular gynecological follow-up regardless of pap smear intervals. Here's why. Endometriosis itself does not increase the risk of cervical cancer, but the disease can cause complex pelvic symptoms that require ongoing monitoring. Patients with endometriosis often have coexisting issues such as ovarian cysts, pelvic adhesions, bladder or bowel involvement, hormonal fluctuations. Many women with endometriosis are also navigating fertility considerations, hormonal management, or post-surgical follow-up, which need more frequent specialist care than routine population-based screening. In other words, if you are under care for endometriosis, your gynecological visits should be individualized based on your condition, not just general screening guidelines. There are certain situations where more frequent pap smears or additional follow-up might be recommended. If you have a history of abnormal pap smears or precancerous changes, if you test positive for high-risk HPV strains, if you have a weakened immune system, for example, due to HIV or certain medications, if you were exposed to DES in utero, a rare circumstance but is still monitored, if you are being followed for pelvic abnormalities or chronic pain syndromes that warrant closer surveillance. In all these cases, your gynecologist will recommend a customized screening and follow-up plan. Stay proactive with your health. To summarize, a pap smear is an essential tool for detecting cervical cancer and precancer. Most women should follow national screening guidelines, but annual checkups are still recommended even when the pap test is not due. Women with endometriosis, pelvic pain, or other complex gynecological issues should maintain more frequent and individualized follow-up with a specialist. And if you ever experience new or concerning symptoms such as pelvic pain, bleeding between periods, pain with intercourse, or changes in your cycle, do not wait for your next routine checkup. See your doctor promptly. Thank you for watching. I hope this video has helped you better understand when and why to get a pap smear and why regular gynecological care is so important. If you have questions about your own screening schedule or if you live with conditions like endometriosis or chronic pelvic pain, remember, your care should be individualized and led by a team that truly understands your specific needs. If this video was helpful, please like, share, and subscribe for more expert content on pelvic health, endometriosis, and excision surgery. And if you'd like to share your experience with routine gynecological care or screening, please leave a comment. Your story could help other women feel empowered to take charge of their health. Take care, and I'll see you in the next video.